Good morning, everyone. It is my absolute pleasure to moderate this panel discussion on data flows in healthcare, organized by Digital Europe as part of the Summer Summit. And I'm gathering here today top policymakers in the European Union and industry leaders to talk about the challenges and the opportunities of the data economy, also referred to as Digital Decade of 2030. And before I will introduce the exciting speakers of this session today, I'll set the scene of this panel discussion and provide you with some overview of a national initiative that has been a unique data access point. The COVID pandemic has indeed been a wake-up call for all of us for the need to share health data in a commonly usable format. And the European health data space will be an opportunity for better interoperability between data standards and also between data access points, and will set the scene also on the need for innovation and research in the European Union. Let me talk a little bit about one national major initiative, which is called the Health Data Hub in France. It is the unique gateway to access health data for public interest research. It's quite new. It's been created end of 2019 and seeks to guarantee the easy, unified, transparent, and secure access to health data and to improve the quality of care and patient support. The Health Data Hub is a public structure reuniting at least 56 stakeholders in its General Assembly. So it represents the whole health data ecosystem in France. It is not only a unique gateway to access health data, but also offers a documented data catalog, which is evolving and adapting in a progressive manner together with data controllers to really include the most strategic databases into that catalog to enable innovative research. And it also offers a state-of-the-art and very secure platform to conduct analyses in project spaces and a range of tools to bring together key stakeholders in the sector. As you see on the next slide, the Health Data Hub has been quite active in 2020 since its inception, end of 2019. We've been active both at the national and international level, but at the national level already we're supporting 27 pilot projects, which you can also see on our website with more details on these projects. 9 of them have been related to COVID-19. So the Health Data Hub has been a very important actor in the pandemic. And we're working together with, we've been working together with more than 20 data controllers and different institutions to develop data sharing agreements. And the institution has been growing quite importantly. We've now more than 50 collaborators in France. We've also launched several versions of the platform, and there's already have been many projects on the platform. So it's a very ambitious initiative with many federative events as well. We've organized different colloquiums, and we're very active in the European Health Data Space Joint Action, which we're going to speak about today, TEHDAS. We're also very interested in artificial intelligence and health, and have organized a very ambitious winter school early this year, and there will be a new edition next year. We have also organized a data challenge, and there's so many more I could tell you, but I'm very excited to start the panel. So if you could go for the next slide, please. These are the priorities for the Health Data Hub in 2021. So there's 5 priorities to keep providing end-to-end support for project coordinators, which we're already doing, and seek to increment that, to pursue the internal structuring and to get involved in many strategic partnerships, both at the national and international level, and of course to pursue developments around the technological infrastructure, and to liaise closely with the general public, as citizens are part of our DNA, even of our governance, as our vice president is the president of the French Umbrella Association for Patient Associations. If you'd like to check out more about the Health Data Hub and our activities, as you can see on the next slide, we're quite active, very up-to-date website, active on Twitter and LinkedIn, and we have a lot of information to share. Now it's time, as I've introduced what the Health Data Hub does, to introduce a little bit more this important panel on data flows in healthcare. And there's mainly 3 questions that I'd like to address today. First of all, what impact data will have on patient outcomes and on health systems, but also how can we better facilitate and accelerate data sharing across Europe and reduce the fragmentation that we already see between databases and data access in the European Union. But also I want to see what are the cross-border data transfers, why it is so important for healthcare and the healthcare sector to foster innovation and research. Now, that being said, I will now introduce our exciting speakers in our panel discussion. starting with Padraic Ward, who is head of commercial operations at Roche Pharma International and has occupied that role since 2018. He joined Roche actually in 2004 and has worked in a number of key roles, including leading the team bringing a new medicine for breast cancer through the final stages of development and regulatory approval, and has been leading the commercial organization first in France and then in Europe. Our next speaker will be Gligor, who is head of unit for European reference networks and digital health in the European Commission in DG Health and Food Safety, SANTE. Before joining DG SANTE, Ioana was deputy head of unit in the Secretariat General of the Commission and in DG Employment and Social Affairs, and assistant also of the Director General of that directorate. And last but not least, we'll have Markus Kalliola, who is a project director in Sitra's Health Data 2030 project. Sitra is the Finnish innovation agency, and he's there as a coordinator in the EU's joint action towards the European health data space, which we're going to speak about today, TEHDAS. And the Health Data 2030 project seeks to create solutions, draws up rules, and builds a bridge for the cross-border use of health data in Europe. So you can see this panel will be very promising, and it's my pleasure now to start with the first question for Padraic. Padraic, why is data so important for a company like Roche? Could you give us a few examples of treatments and of research in the EU where you have used data for their development?
Thank you, Louisa. Good morning, everyone. Or good afternoon now. So Roche, I think many of you know, it's a now 125-year-old healthcare company based in Basel in Switzerland. We operate all over the world. We've got two major divisions. We have a diagnostics division, which is a world leader in vitro diagnostics and in cancer tissue diagnostics, and has also been heavily involved in developing over the last year or so antibody, antigen, and PCR tests for COVID, things that we've all become sadly very familiar with. The division I work in is the medicines division, and we are involved in developing innovative medicines in many different disease settings, particularly in cancer and central nervous system diseases and rare diseases and others, and also in an attempt to bring medicines forward to treat COVID. We have a third, smaller part of the company, which is a medical insights business. That's something that's developed in the past few years, where we're looking at trying to understand better the molecular drivers of cancer growth, for example, and to try and put that together with data at scale to understand how those can be used to get better outcomes for patients. The objective of the whole thing, of having those three divisions and all of the work we do, is in pursuit of what we're calling personalized healthcare. The idea that it would be possible to make sure that the right person gets the right intervention at the right time. So starting with the right diagnosis at the right time, then a treatment that is as well matched to the particular version of a disease that anybody has, and then a personalized healthcare plan to make sure that that progresses the way it's supposed to, and that any adjustments can be made over time. And it doesn't take a huge leap to understand that in order to do all of that, data is at the core of it. But it's not just data in any sense. It's what we're calling meaningful data at scale. Meaningful in the sense that it's appropriate to the kinds of questions we're trying to ask, that the quality of it be high and standardized, that the interoperability rules be in place in order to make sure that different sources of data talk to each other in the way that we needed them to, and at scale, because the only way that we can really develop a deep understanding of disease is by making sure that we have data at a very large scale. We have to start thinking about diseases that we thought were common as being relatively rare. And the more we understand about individual tumors, the more that we understand that a single lung cancer tumor or lung cancer, say, is not a single disease anymore. It's many diseases. And we're going to need to have data available to us at scale in order to be able to, first of all, understand that, and then figure out how we can best treat it. We're looking to, and I think if we can do that, then the outcomes should be great for everyone. It should be great for patients to start with, and that should be the whole objective of it in the first place, just to make sure that patients do get better outcomes than they can get even now. It should help make healthcare systems more sustainable. Because again, when you have a scaled number of patients who are getting better outcomes with less waste, with better interventions at the right time, that's good for sustainability of healthcare systems. And in Europe, if we can really pursue a common a European health data space, it should help to strengthen or help Europe regain its position as at the core of healthcare research and development, which we've lost a bit over the past 20 years or so. We already, I mean, we're still at relatively early stages of all of this, but there are great examples out there of how you can make a difference. You know, I go from one end, the idea that, you know, using one of the services that we provide, a healthcare professional can quite quickly get back a report showing him or her what is the specific molecular driver, the specific mutation that's driving the growth of a tumor, what medicines are available that might help treat that, what clinical trials are ongoing that might help the patients if there isn't an approved medicine already, and they can do that very quickly and in a standardized way. And then I go all the way to the other end, where we've had great experiences over the past couple of years with things like apps that help patients to record the what's happening to them at any given point in time, side effects they might be having, how they're feeling, and that can be quickly triaged by healthcare professionals, and then interventions made when needed. We all know it happens to all of us, never mind to a cancer patient. How you're feeling at any given point, you might have forgotten by the time you get to see a doctor some weeks later. And to be able to report those things in real time helps physicians and nurses to calibrate treatments at different times and to intervene when almost in real time. And we've got some data to show that it helps patients get better outcomes than otherwise would be the case. So much more of that to come, but those are just a couple of examples of things that we're already doing and already doing in Europe.
Thank you, Padraic. This is so inspiring and sets really good examples for us to discuss later. I was going to build up on the European health data space, but I believe we can hear first Ioana on this question on the status of the European health data space and what are the current legislative developments.
Thank you very much for this invitation. I prepared some slides that could provide an overview of the state of play. Thank you very much. If we move to the next slide, you have a description of the problems that we are encountering in this area. So, with regard to the sharing, we are basically working on two main areas of work on the primary use of data, so the use of data for the healthcare, and then the reuse of health data for research, policy making, regulatory purposes, developing of innovation, artificial intelligence, etc. So when it comes to the use of data for healthcare, what we are seeing there, it's in terms of issues that have to be tackled, and we are trying to address them through the legislative initiative and also through other measures. So those issues are related to limited access and control of patients over their health data, which also leads to repeated tests, high costs for the patients themselves and also for the society, insufficient exchange of health data between the countries and within the countries, and also limited interoperability within within the country and cross-border. We also see issues related to the digital health services and products, even if more and more people are using mHealth, telehealth services, and I think that the COVID crisis has really pushed these digital health services forward with a lot of legislation done at national level. However, when it comes to cross-border, there is still a lot of fragmentation and a lot of unevenness in terms of interoperability, in terms of quality of these telehealth services and products, in terms of the possibility for patients to decide how their data coming from these devices is being made available to them and to the healthcare professionals that are treating them, etc., etc. There are also issues related to the reimbursement, even though the framework, for instance, it's set out in the Social Security Coordination Regulation and the Patients' Rights Directive. The digitalization it's anchored, but it's still not yet there in terms of the package of services that the patients can benefit from. When it comes to the reuse of data for research and policy making and regulatory purposes, we have also done a study at the beginning of the year, and this shows basically quite a lot of fragmentation in the way that member states have implemented the GDPR, a lot of exceptions, and a lot of different legal bases. And we were joking also sometimes with the colleagues that if we put all the legal bases plus the exceptions under Article 6 and 9 of the GDPR, multiply by the number of the member states, a researcher or a policymaker has to deal with a kind of a QR code to do a cross-country study. So this is something that we try to see how we can overcome, and examples like the one showed by Louisa with a trusted governance and a trusted infrastructure show that there are ways of reducing the fragmentation and ways of trying to build an ecosystem for data access within the EU. Also, in terms of artificial intelligence, we see a lot of issues related to the development and also for the regulators themselves, a lot of challenges in terms of what kind of information they have available beyond what is being offered to them by the manufacturers themselves, what type of control keys, control data sets they have at their disposal in order to validate, for instance, AI algorithms. And this is something that we try to see how we can further develop, also building upon the recently adopted AI regulation. If we go to the next slide. So there you have a little bit the main areas of work. So the primary and the secondary use of health data with several types of instruments. With the legal proposal that will be presented at the beginning of next year, following these pillars that I was mentioning. So the use of data for the healthcare, strengthen interoperability, digital health services and products, the use of health data and artificial intelligence, but also support for the improving quality of data, making data findable, accessible, interoperable and reusable infrastructures. And I will come back to this a little bit later, both for supporting the cross-border sharing of patients' data, but also for supporting the collaboration on reuse of health data, and also capacity building. And there I don't only mean, for instance, training, cooperation, best practices, but also the unique opportunity which is offered now by the multi-annual financial framework with several sources of funding, be it Recovery and Resilience Facility, European Regional Development Fund, InvestEU, even the European Social Fund for the Skills, and also the opportunities offered by the funds like EU for Health, Digital Europe program to create cross-country infrastructures and collaborations, and the opportunities offered by the Horizon Europe for development of research. And if we go to the next slide, I was basically saying that we do not aim to build everything from the scratch. There is already a very strong acquis, especially at European level and also at the national level, and we try to build upon that. The first one, of course, is the GDPR, which also allows for national and European law to govern the processing of data. And in this context, we are aiming to come with the European law for the data processing for different purposes. The cross-border healthcare directive, and we are aiming to take forward the current provisions of the cross-border healthcare directive, which set out the e-health network, which has already done a lot of things, including the sharing of data, including contact tracing apps, including digital COVID certificates, to name just a few. So there is clearly a lot of potential and willingness also to further develop the European collaboration. And we also aim to see how we can further strengthen this collaboration also for the secondary use of health data. And I'm sure that Markus will provide much more details about the joint action towards the European health data space, which will also support the legal proposal and also the action of the EU in this area. We are also building upon the Data Governance Act, which sets out a framework for the use of data, for the reuse of data for several sectors, and we are aiming at lex specialis to the Data Governance Act for the health sector, and also the recently adopted AI regulation with specific provisions for the health sector. If we go to the next slide, I was speaking about the sharing of data within and cross-border. I think there we have quite a lot of advancement based on the work of the eHealth network. For the time being, we have 7 member states which have been sharing patient summary and e-prescriptions cross borders. We have quite a lot of good results, around 20,000 e-prescriptions dispensed, especially between Finland and Estonia. So the more we have the neighbors, the better, the more exchanges we have. But also several patient summaries, which include basic information about the patient, from allergies to medications, surgeries, etc., which allow the healthcare professional to understand the problems of the patient and to provide a better treatment. And this information, it is provided in the language of the doctor. So what we are aiming at, and this year basically these exchanges will be enlarged with up to 8 member states, is to strengthen this capacity of the patients to share their data with healthcare professionals when they travel abroad, and also to strengthen interoperability through the same tool. We are also aiming at enlarging the type of information which are being exchanged with images, lab results, and discharge letters, and also to provide the access to patients to their own health data. And what has been happening with the digital COVID certificate, it's a very good example that there is an appetite and an interest to allow the people to have their data available on their smartphone in the language of the country where they travel. So this is what we are trying to take this further, this infrastructure. If we go to the next slide. Of course, this cannot be done without interoperability. The Commission has put forward the European Electronic Health Record Exchange format, and the eHealth network has been working quite a lot on taking this up further. And we will see also to how we can further reinforce the interoperability in the context of the European health data space, because this is fundamental to allow the sharing of data cross-border, but also internally. So there you have some standards and specifications, and we will try to see how this can be further strengthened. Now, going to the next slide. For the reuse of data for research and policy making, there the aim is to create a trusted framework, a trusted governance, and also a trusted infrastructure. The examples like French Data Hub and FinData show how this can be done nationally. We try basically to take this into account in the context of the legislative proposal, but also to build the infrastructure that would allow these governance models to cooperate to each other and to support policymakers, researchers, and also industry to access the data cross-border and to really have much more meaningful information and work coming out of this. And this will also support basically the development and deployment of the AI. So maybe just one element, where are we now in all this? We are now in the process of public consultation. So I would really invite you to contribute to the public consultation. And at the same time, we are also doing the impact assessment for the legal proposal. And we are working on supporting different digital infrastructures that I mentioned to this effect. So thank you very much for this opportunity, and look really forward to your contributions for the public consultation and your ideas and input.
Thank you so much, Ioana. It's really good to know how active the Commission is to promote the regulatory framework for both primary and secondary use of health data. And having also heard a major biotech and pharmaceutical actor in the beginning, who also, I guess, will be part of the European health data space, the countries also need to be part of that. And the countries are currently designing the concepts for the European health data space, aligning lots of stakeholders, including also the private sector. And Markus will be the one who will explain it to us a little bit more. What is the joint action towards the European health data space? Markus, the floor is yours.
Thank you, Louisa. So before going to TEHDAS, I would like to just raise one point that Padraic was saying about the data and the importance of it. I think one aspect that I would like to add to that discussion is the preventive side of data. And we also need research on how to bring the preventive mechanisms to citizens so that they could actually live a healthy life and not needing those treatments that are available. But of course, then when the treatments need to be done, then we need to personalize treatments that the data also can provide. Going to TEHDAS, so you saw Ioana's presentation, which was very good. So in TEHDAS Joint Action, it brings the member states together. So we have 25 countries working on these topics that Ioana was mentioning on the presentation. So we are working on the secondary use of health data from those pillars point of view. So looking into the governance, data quality, infrastructure, and also citizen engagement regarding the European health data space. And the work is going very nicely at the moment. So we started on February, and so we have run 5 months now. And I would say that the train is on the tracks, so we are progressing well, and in all those thematic areas that we work on. The purpose of TEHDAS is to provide options for the European Commission and the member states. I think one key takeaway also that I would like to highlight is the importance of engaging stakeholders. For example, Digital Europe has been involved in our advisory group, as well as many other sectors, industry, patient organizations, professional organizations, and so forth. The joint action brings member states together, but it also engages with other actors, initiatives, and projects. And this year we, for example, had one project forum where we had 50 European projects talking to each other about their initiatives and how to use data in Europe and how to build the European health data space. So I think TEHDAS tries to facilitate the discussion, to have dialogue with all the partners in the game. So that's what we are doing, and looking forward also in the future to collaborate as many stakeholders as possible.
Thank you, Markus. That brings me back to Padraic for that question on the European health data space and on the potential implication of the private sector. What are your expectations for the European health data space?
Well, the first thing I would say is we're really encouraged by the direction that this has started with, and the idea that we're actively participating in the public consultation, and I hope many others will too. So I think it's all heading in the right direction. Ioana, I think, hit on it. I lost count of the number of times, Ioana, you used the word fragmentation in your talk, and I think that's at the heart of the problem we have. We have great healthcare systems in Europe. We have great public health universities in Europe. We have loads of dynamic people in the public and private sector and companies big and small who are only just waiting to be able to use their full potential to make all of the difference that we want to. But fragmentation is getting in the way. And so the more we can do to overcome that barrier, and you also spoke, both you and Louisa spoke, Ioana, about the questions of interoperability and quality. And what we're really hoping for is a mechanism or an institution that can take from beginning to end the policy cycle, make sure that the appropriate standards for quality and interoperability are set and enforced, so that we avoid some of the difficulties that we've been running into with GDPR, which Ioana also mentioned, as we move forward. But in sum, you're really encouraged by the direction that's taking, and we're definitely on deck to participate in whatever way we can.
It's also the perspective I can bring in from the French Health Data Hub. We indeed see ourselves as a way to reduce the fragmentation, at least at the national level. And at the European level, obviously, the fact of creating such a European health data space and even common structures could be a solution to reduce that fragmentation. So I'd like to hear, Markus, what could be the next step for you? And then also Ioana as a next response. What are the next steps towards the European health data space?
Well, I think if you look at it from the TEHDAS joint action perspective, we are looking at these different thematic areas of the European health data space. And their next really concrete step is that we are looking at the governance aspect, for example. And in this month, we will publish our first results of TEHDAS, and the next one coming up at August. So we are looking at why health data is a specific topic in governance in general. We are looking at different mechanisms that the data is being governed at the moment in Europe in the secondary use way, and we are analyzing those. And of course, we are then providing later on different options for the European Commission and the member state of how to progress. And similarly, we are doing that also in the data quality, looking at the different data quality frameworks, data quality assurance frameworks, as well as the infrastructure that Ioana mentioned. So we are really providing concrete results for the building of the European health data space. So that's what we are really concretely doing. But I think Ioana also has even something more concrete with also the pilots that they are doing and planning.
Ioana, please tell us more about the pilot project.
Thank you very much. So basically, we are, as I said, advancing on the legal proposal, but at the same time, we are also advancing on the infrastructure, scaling up the My Health at EU, and also a pilot project on providing, which is foreseen by the end of this year to be launched, a pilot project on supporting the people's access to their health data in the language of the country where they travel. And another pilot project that we are aiming at is to support the collaboration between authorities, data permit authorities, French data, FinData Hub, etc., in member states with research infrastructures and public actors like EMA and ECDC to try to see and test how an EU-wide infrastructure for cross-border access to health data could look like. It's a little bit, let's say, a trial and error exercise that will shape the final infrastructure, but one that can also help basically understanding what are the main challenges in terms of identifying where the data is, in terms of the procedures that have to be followed by researchers, in terms of how to interrogate the data. Do we need to what extent we can do federated learning, federated querying, to what extent one needs to aggregate, etc. So all this will offer a lot of insightful information. We are trying to serve also the needs of European Medicine Agency and their Darwin project, in order to have some concrete use cases. And basically, I think there are some very interesting use cases that are being developed related to disease trajectory, to blood clotting, history, etc. Okay, I don't want to I don't know what it will come out of this project. It's something that it's a bit of a trial and error, but I hope it will clarify the main issues related to the legal, organizational, interoperability, and infrastructure aspects for the European health data space for the secondary use of health data.
Thank you so much. This brings me also to the end of this exciting panel discussion, and there's been a lot of elements which have been said, and I believe we all of our sectors, all of our structures should be part of that future European health data space. We should enable a wide participation of all actors, including citizens, which is one of the questions that has been raised, and Digital Europe will obviously respond to all other questions, and you will all get answers to your questions after this event. But I think also the joint action TEHDAS presented by Markus shows there's one work package even on citizen engagement, which also the Health Data Hub is involved in. And I believe, having heard from Padraic also how important patient outcomes, how important patient-centered care is, and also in the view of personalized medicine. So I believe we all reached some form of consensus on the need to foster interoperability between data sources, but also trust, to gain the trust of citizens. And that's why I'd like to leave you here for this panel discussion. And thank you so much. And also reiterate Ioana's call for participation and the consultation which is ongoing. Thank you all so much and have a great day.